Hello and welcome. I am Ashok Rajguru, your tutor. This presentation is about symptoms. Symptoms, of course, are of prime importance to the homeopath, and this is going to be a recap or a review of what probably you know already. We are going to have a look at what sets homeopathy apart. How do we look at symptoms differently from other forms of medical practice? This graphic, which I am going to display, is adapted from a book called Principles and Practice of Homeopathy by Dr. M. L. Dore, who was an Indian homeopath. At the center of all our discussion on symptoms is the vital force which animates our body and gives us our bodily functions, our emotions, and our intellect. Normally, when the body is in a state of health and the vital force is in harmony with its surroundings, there are no symptoms that are produced. However, when there is sickness or disease, the vital force is disturbed and there is disharmony. And that is when symptoms are produced in the mind, body, or in the intellect. So a person's thinking or a person's decision making and discriminatory faculties or the body will show symptoms. Symptoms have four important elements for us to use them effectively in our analysis of a case. Those are location, modalities, sensation, and concomitants. We shall look at each one of these in greater detail during this presentation. We will also be looking at how to recognize the state of the symptoms because they will be telling us about the evolution of a disease or sickness. We'll be looking at what are the individual symptoms, how they affect the functionality of organs, when they become structural impediments, and once there is structural damage or change, how secondary symptoms come and make it difficult for the homeopath to effectively use symptoms for the choice of a remedy. We will also see how we can classify symptoms for our analysis. These are the different classifications: acute and chronic. We'll be taking a look at each one of these later. Generals, particulars, chief complaints, concomitant complaints, common symptoms, characteristic symptoms, recent symptoms, old symptoms, and symptoms caused by some accident or injury. Now, as you can see in this graphic, this typically shows the worldview of modern science or allopaths regarding the human body. The human body is seen as a machine. The brain is likened to be like a computer. The eyes are like video cameras. The muscles are the motorized parts of the body. The heart is a pump which is squirting out hydraulic fluid called blood. And the GI tract is nothing but a passage where chemistry is working to absorb nutrients through osmosis and diffusion. So this mechanistic view has not changed despite the great advances in science that have taken place. So they are still searching for a ghost in the machine, and the concept of vital force is often ridiculed. Have a look at what Crick and Watson had to say. Sir Francis Crick and Dr. Watson were awarded a Nobel Prize because they were able to decode the DNA structure. And back in 1966, this is what Francis Crick had to say. The ultimate aim of the modern movement in biology is to explain all biology in terms of physics and chemistry. Quite a strong view of the mechanist reductionist philosophy that still rules over the minds of medical practitioners other than homeopaths. This passage is taken from a book which he wrote in 1966 called Of Molecules and Man. However, there is a ray of hope. 50 years after this book has been written, One computer scientist and a network engineer, German engineer, has written this beautiful poem which translates thus, and he says, one water molecule is not fluid, one gold atom is not metallic, and one neuron is not conscious, and one amino acid is not alive. So what it points to is that when we are talking about the human body, about life sciences, we are dealing with complexity, and that cannot be handled with simplistic views of physics and chemistry as they were understood 50 years ago or 100 years ago. I had mentioned that life systems are essentially complex, and whenever there is complexity, there is something we need to understand, and that is the science behind chaos and emergent phenomenon. What exactly does emergent phenomena mean? All it means in simple language is what Aristotle had said many years ago. In fact, many centuries ago. Now, what you're seeing on the screen, and I'll take it off in a while because it could be very disturbing to some people, is not random motion. It is a program created by a computer with a very well organized code. But it can give you various impressions depending on your mood, depending on your angle of viewing, and so many other things. So this is what complexity is all about. Complexity is made up of simple parts, but it is an emergent phenomenon in which you cannot predict the outcome without knowing all the variables which will never be known. That is why in his wisdom Aristotle had said that the whole is something besides its parts. This is the original quotation from Aristotle. Unfortunately, it has been distorted in translation, and what we hear today is that whole is something bigger than its parts. It's not a question of big or small. It is something besides its parts. That is a very important point to note. So the whole is something besides its parts. Let's see what Stephen Hawking, one of the leading physicists of the last century and who is still alive, has to say. He says, I think the 21st century will be the century of complexity. All this while, it has just been about simplistic theories and making complicated stuff out of those simple elements. Complexity is a all new world out there. And that is the world that Hahnemann had addressed through his concept of homeopathy, and we'll just see how. So first of all, let's have a look at the allopathic approach. The allopath is also looking at symptoms in science, but with a different perspective and a different worldview. He has got a diagnostic approach, which means they want to name a disease so that they can act on it in a formal, recognized, authenticated way, which is approved by their school. So they are highly selective of symptoms, and they only look at particular type of data. For instance, they would be interested in the blood pressure, in the temperature, in the heart rate, maybe some parameters in the blood or the urine or the stool, and stuff like that. Anything that is outside the realm of that particular filter is of no consequence to them, for the simple reason it does not help them to diagnose or put a name or a label on the disease or the complaint that the patient has brought. They are guided by what has gone through the mill. On the contrary, for a homeopath, every case is virtually a new case because each patient who comes there is a different individual, a unique entity. Allopaths have a preconceived plan for diagnosis. A homeopath can never have that because no two people will exhibit the same symptoms for any kind of a named disease. For the allopaths, individualizing and characterizing symptoms. For instance, a patient feels cold, has cold hands and feet, or is aggravated when there is a storm. All this is literally rubbish for them. And this school of thought is actually considered scientific. Now, back to symptoms, let us see how symptoms evolve. They evolve in stages. So the first stage is that a person has a feeling of unease and what is known as the prodromal symptoms. This is a stage when they depict individual reactions and they are mostly affected by the constitution of the person. So they are very important. You can ask a patient how he felt on the very first day when the discomfort started. So they can be a very good clue towards the remedy that could fit into it. Sometimes it can even fit in before the real disease has had its onset, or even after the onset of a disease. These are important pieces of information for us. Next, the symptoms are created by disordered functioning of organs. So if somebody is having a badly functioning kidney, he will now start exhibiting symptoms of the urinary tract in a particular way. However, as the disease progresses, there could be structural changes of the organs and tissues, and they will produce a set of symptoms of their own kind which are different from the first two. If you are having blockages in the heart arteries, those are structural changes, and they will create their own symptoms peculiar and particular to those structural changes. So that must be borne in mind. Then the symptoms that will come to the fore are after the structural changes have taken place, and they will lead to secondary symptoms. So blockages of heart will ultimately create other symptoms because of the paucity of oxygen that is reaching other organs. So that is how symptoms evolve. So we should be able to find out what is the stage of disease and what those symptoms mean. Are they prodromal symptoms? Are they symptoms of dysfunctioning of organs? Are they symptoms created by structural changes of organ tissue? Or are they symptoms which are secondary symptoms after gross structural changes have taken place to the structure? The next thing we want to look at it is secondary signs, because secondary signs arise after structural changes have taken place, and they can be a good guide to prognosis of the case. Structural changes to tissues and organs can lead to mental and other physical symptoms. A person may feel dejected because he is losing his earning because of his reduced physical capacities as a result of the structural changes. These mental symptoms are a consequence of the disease advancement, so that must also be taken into consideration. Now these symptoms, the secondary signs and symptoms we are talking about, they can mask the individualizing characteristic symptoms, because now they become symptoms that belong to the disease affected organs which have been changed structurally. Physical symptoms due to changes caused by disease now predominate the scene, and there are very few things which can help you to characterize that individual. This is a stage when it becomes very difficult to individualize on basis of symptoms, and the case becomes difficult to treat. In the first slide, we talked about symptom classification. Here is a simple classification which will guide you and help you to determine which symptoms must figure in your case analysis. If we take symptoms, we have some common symptoms. Common symptoms are based on pathological changes, and they are useful to the allopath for diagnostic purposes, but they are of very little use to us because they are related to the disease itself. They can be important only if they are very intense, which means they can help to point towards a remedy which points to either the intensity or the pace of the disease. Then you have very important set of symptoms which we call as characteristic symptoms. These symptoms cannot be explained by pathological changes alone. They have a constitutional basis, and they point to the individual's response to disease. They tell us more about the vital force and the state of the vital force of a person. Then we have symptoms which are known as the chief symptoms or the chief complaint. This is the trouble that brought the patient to you in the first place. And then you've got concomitants. These are symptoms which appear to be of secondary nature or less important to the patient. But all the same, they are interesting and very important to us because those symptoms seem to have apparently no relationship with the chief complaint. Hence, they are very important from the homeopathic point of view. So a quick recap on this slide. Common symptoms are of little use to us. Characteristic symptoms point towards individuality. Chief symptom must be taken into consideration because that is what has brought the person to you, and concomitants of course are very important because they seem to have apparently no connection with the main complaint. Continuing further, symptoms are also known as general symptoms. That is when the person uses the pronoun I am not well, I feel cold. So they are important to us, and they are more important than particular symptoms where the pronoun normally is my. My hand pains, I have an ache in my belly. So those are my symptoms. Unless a particular symptom is very strong or intense, it will have a lower place in the hierarchy of symptoms and gradation. Of course, if there are some particulars which have a sensation which occurs in more than two places, that can be treated as a general. For instance, if a person has got burning eyes, burning nose, and he's got, say, burning in the rectum, then burning becomes a general, which is more important than all the three particulars put together. Then a symptom can be acute or chronic. You have to be very careful with this because many a times people come to you for apparent acute afflictions, but they are really chronic in nature. They are just acute exacerbations of a chronic conditions. So you'll have to take a case and examine and question whether this is a recurrent problem and a chronic problem or just an acute problem. As people go advance in age, most acutes should be treated very carefully because they are most likely acute manifestations of an underlying chronic disease process. Then of course we have some old symptoms and recent symptoms. The recent ones provide the best clue for the first prescription. Now I'm going to come to a very important tool or approach to repertorization. In the earlier slides, we have seen what are the different types of symptoms, how we have categorized them, and now it's time to see how we can effectively use them. I'm not going to discuss the Bonninghausen's method in detail in this particular video, but this is an effective tool which you can use, and it's known as the Bonninghausen diagram, X diagram. So on a clean white sheet of paper, make a large cross like the alphabet X. And in each quadrant, you can mention location, modality, and each one of these means the location will be able to be, you will be noting down the area, site, or the description of the kind of malady or sickness or disease that the person is exhibiting. By extension, we mean, does the pain extend in one particular direction? Outwards, inwards, upwards, downwards. That is very important. Then next is the side. Is it left-sided, right-sided? Is it moving from left to right? Is it moving from top to bottom? That of course is very important. Another thing to note is that pain a referred pain? For instance, a person could be reporting pain in his fingers, but that could be a referred pain because of a tender spot in his muscles or some kind of a compression in one of the vertebrae. So it is important to know what kind of a pain is it. Is it pathological? Is it a referred pain, or is it something else? And also important is the diathesis. For instance, a person suffering from an acute attack of gout. The gout itself is actually a part of a constitutional disorder of the person. So it is important to know that also. Modalities are next to consider, but they are the most important when it comes to individualizing a case. Modalities can often point towards the causation, which a person may not know. Modalities can be emotional in nature. For instance, a death in the family, a divorce, some other kind of emotional disturbance could have triggered or been the causation of the disease. Susceptibility is another important thing. Is the person more susceptible in winter or in summer? Then of course we have generals, which describe all kinds of modalities including time, location, thermal conditions, etc. What aggravates and what ameliorates, and as we have seen in another video, aggravations are more important than ameliorations. Next of course is sensations, which are reported by the patient. More importantly, those sensations which cannot be described on the basis of pathological basis. And as we mentioned earlier, concomitants are extremely important. Those are those symptoms which apparently do not seem to have a pathological basis or a connection to the chief complaint. Now here are some priority rules which you can keep in mind when you are applying or using these symptoms for repertorization. Strong generals overrule any number of particulars. So if there is a burning sensation in two or more parts, then of course it's the general that's going to overrule any particular or location. Intense or strong particular can assert over a weak general. So that's another important point, because the intensity or the pace is of greater importance to us in determining the kind of remedy. For instance, aconite has got a very fast pace of the onset of symptoms, whereas bryonia and gelsemium are slow-paced remedies in the onset of their symptoms. If a person is reporting a sensation or a modality in more than 2 locations, consider that and treat that as a general. And in the case of lack of symptoms, then you can apply Bonninghausen's philosophy that what is true for a part is also true for the whole person. So these are some general guidelines. Now in this particular module, I will be presenting cases where all these rules and all these guidelines will be put to practical use for you to use and learn effectively while you're sitting on your computer and repertorizing with me. So it is not just another talk and chalk show. This is something you're going to put into practice in order to solve your cases effectively, efficiently, and repeatedly. Once you have taken into consideration all these symptoms, there are some symptoms which you must take for later consideration and which are of very great importance. Those symptoms, for example, are about the sexual drive. You should check allopathic medications for their side effects. There are so many allopathic medicines that people are taking which can dampen the sexual drive. Menses. For any problems that are reported, check if your patients are on some kind of hormonal treatment or contraceptives or such things. Side effects can either create or mask many symptoms in this area. Menopause is another thing you must take into consideration when you are determining a remedy. And most importantly, you should also consider that many remedies have got a propensity or an affinity for certain tissues. Kali salts, for instance, have an affinity for mucous membranes. Serous membranes are often well treated by bryonia and a few other remedies. Same applies for cartilage. So you must take the tissue into consideration. And finally, there is something known as pathological generals, which was introduced by Boger and which can be repertorized, are pathological generals such as swellings, cysts, vesicles, eruptions, ulcerations. So these kind of things will also help you in your analysis. So now I'll go through a quick summary of what we saw on this video. We first started by comparing the homeopathic approach and worldview versus the allopathic one, which is essentially diagnostic, mechanistic, and reductionist, and has got no consideration for the vital force. We also saw that the current understanding in science is now increasingly growing, and they are accepting that emergent phenomena like life sciences are complex and chaotic and need a different kind of a science and mindset in order to understand and deal with. Not everything can be explained on the basis of elementary parts. Then we had a look at the evolution of symptoms from the prodromal symptoms all the way up to the stage where there is a structural change to the organs and tissues, and how we must understand those symptoms in view of those changes that are taking place. Then we had a look at the classification, which considered the generals, particulars, the recent, old, and the other remaining categories. And then we saw the relative importance of the symptoms between generals and particulars, between sensations and modalities, and the importance of concomitants. Then we saw how we can build a complete picture by carefully noting down these symptoms and distributing them in each of the 4 quadrants of the X diagram. Also, we saw what are the other considerations such as polypharmacy and excessive drugging by allopathic drugs, which can create their own symptoms or suppress some natural symptoms that the patient would have presented otherwise. So I hope this video has helped you, and it will help you tremendously when you look at the cases and the remaining modules in this tutorial, which will help you to apply the knowledge that we just discussed. This was a very concise summary, something that you already know, but which is going to be of tremendous use to you in your practice. Thank you for your attention and hope to see you soon on the forum. I'll be looking forward to your comments, your suggestions, and your discussions. So please don't miss out on the fun. Thank you and bye-bye.